These were the most helpful tips I wish I knew when I first started clinical rotations as a medical student. Also, this is day 190 of racing my brother to 100,000 followers. Hands down, the best thing that I wish I got when I started clinical rotations is this pocket medicine book from Mass General Hospital. In the first couple years of medical school, you're learning how to diagnose things, but once you start clinical rotations, you're going to start getting asked, well, what do you want to do next? And this book tells you what you want to do next. It's primarily a book for interns, which is how I heard about it. So getting your hands on this as a third or fourth year medical student, I think is worth its weight in gold. The next tip I have is that if you already know your specialty, buy the quote unquote textbook of that specialty and read it. It doesn't have to be a physical book. You can get the ebook if you want it. I personally just prefer physical textbooks. But a great piece of advice I got from an intern is that you read one chapter a week from this book. At the end of the week, you summarize it into one page and you review those summaries at least once a week. The next thing I would recommend is getting one of these H&P books. I've talked about it before, so I won't spend a lot of time on it. But basically, when you go talk with a patient, you're trying to think about so many things like old carts, fed tacos. You're trying to be cordial with the patient that in your first couple months of your clinical rotations, it's very easy to forget a few of the steps that you need to do to present a good H&P. So this book just really helps keep you organized. Use it until you feel comfortable, and then you can upgrade to the folded piece of paper. If you know, you know. And my last tip I would say has been one of the most helpful. And if you've stuck around this far, then hitting that follow or subscribe button really does help out the channel. Now that you're out in the hospital, everyone will be talking about the brand names of every medication that you've already learned under a different name. So one of the doctors I rotated with told me to keep a spreadsheet of all the generic and brand names of the most common medications I start hearing while I'm out in the hospital. And if you just review them over time, this is really the last step because you already know the pharmacology. Now you just have to know what people call it.